All right, hi guys. We're gonna look at cranial nerve testing now. So we have 12 cranial nerves. For your lab portion, we're only going to be testing 5 of those cranial nerves. So we really need to make sure that we know how to test these cranial nerves because a lot of times if us as a PTA are going to be testing these cranial nerves, it's something that we're doing more so in an emergency situation. Maybe we're working with this patient, maybe it's a stroke patient and we're working on them, and then all of a sudden we're seeing a significant decline in function. What we can do is we can do a quick couple of tests, do some of these cranial nerve tests, which indicates if there is a more serious condition occurring. And then we know we want to right away go and see our PT or see the doctor, depending what situation we're in and where we're at. If we're in a hospital setting, nursing setting, and so on. Maybe we're going to identify the nurse if needed there as well. So we're going to go through our 5 different cranial nerves that we're going to test for lab. And the first one is cranial nerve number 1, which is our olfactory. So our olfactory, we're testing for smell. So the important thing when we're looking at this is we want to make sure we have a well-known smell, right? So we don't want to give them like pomegranate or something that's kind of hard to identify. We want to make sure it's very easy and something that the general population should be able to pick up on. So we're going to use peppermint oil. We have different types of oils here in lab that we're going to use. And we want to make sure that we tell our patients when we're talking to them about what we're testing, we want to tell them what we're testing for, but we don't necessarily want to give them what the outcome should be. We just want to make sure that, they're doing what they normally would do. We don't want them to skew the test to try to be a positive or a negative. Okay, so the first one, olfactory. Again, we're testing smell. So with our cranial nerves, we have either a motor or a sensory function, or some of our cranial nerves we're going to test for both. So this is the smell, we're testing the sensory function. So we have Sabrina here, a patient. We want to make sure we have them close their eyes or be blindfolded. So we don't want to have them give any hints as to what they might smell. And all we're doing is we're going to say, Sabrina, can you please close your eyes? I'm going to have a scent. I'm just going to put it right under your nose. I want you to smell it. I'll let you know when it's under your nose. It's a pretty strong smell. And if you can just tell me what the smell is, and that is it. So I'm going to go ahead. You got it under your nose? Good. Yep. So she was able to positively identify that it was peppermint, or I shouldn't say positive. It was a negative test. She was able to identify that it was peppermint oil. So that's cranial nerve test number 1. Okay, the next one we're testing is cranial nerve number 3, which is our oculomotor. So oculomotor, we have motor in the name of the cranial nerve. We're testing for a motor function. So for our oculomotor, depending what text that you're looking in, some texts will actually have you also look at your pupil dilation. We are just going to be looking at the eye function. So you're going to want to have some sort of device. You guys should all have our little handy dandy reflex tools in your lab bags, I am going to be using this, but you can just use a pen, a pencil. Remember, think if you were in a clinic setting, hospital setting, a sniff, even maybe outpatient setting, you just want to use something that you have right on you. So usually it's going to be some sort of a pen. But I'm going to be using our reflex tester. And I'm going to ask Sabrina just to be looking at our end of our reflex tool. What you are going to do is you're going to take the object and you're going to do a vertical movement, a horizontal movement, and then a diagonal movement. You are asking them to track this with their eyes. So we should see normal tracking in one eye. We're really looking at one eye at the beginning, and then we're going to move and do the other eye. What you are looking though for a positive test, you're looking for any type of abnormality in that movement. So sometimes people might have nystagmus where their eye's going to want to bounce. Or if they really just cannot track that at all, that would be a positive test. You also want to make sure that you cue them, make sure that they are not moving their head there as well. So we're just moving the eyes. Okay, so Sabrina, I'm going to have you, this one you're going to keep your eyes open for. Okay. And what I want you to do is you're just going to track the end of this reflex test. So I'm going to bring it up, I'm going to bring it to the side, and I'm going to bring it diagonally. I want you to just track that with me. Okay? So we're going to go ahead and go up. Good. We're going to go horizontally. Good. And then diagonally. Good. I'm going to do that one more time. Coming up. Now we're going to go to the other direction. Good. And we're going to go to diagonal. Good. Good. So looking at both of her eyes. So I'm looking at both of her eyes simultaneously. Both of them the entire time we're able to track normally. So that would be a negative test. Okay, so the next one then, cranial nerve number 5, trigeminal nerve. So this is a sensory and a motor component with this nerve. So patient's going to be seated. The first thing we're going to do is, make sure I straighten this out a bit, is we're going to look at the sensory portion. So on your reflex hammer, there are 2 different sensations. So if you take the bottom of that and you unscrew it, you're going to have a little brush. So we're going to have more of a soft sensation. And then we're also going to take the top of this, and you're going to unscrew that, and you're going to have a little pinpoint. So it's a little bit more of a sharp sensation. So we want to first look, can they even feel anything? And then can they also identify a sharp sensation versus a soft sensation? So we're going to use these 2 sensations. I'm going to ask Sabrina to close her eyes. And what I'm going to do on her is I'm going to either have a soft sensation or I'm going to have a sharp sensation. I'm going to ask if she can identify the 2. You can, it kind of depends on the setting, but if you really are concerned with somebody being a positive, you might also want to ask where. So if I give you the sensation on the cheek, okay, can you say it was on the cheek? If I give you a sharp sensation on the nose, can you tell me it's on the nose? Versus maybe they're just guessing and I did it on the nose, but they say the forehead, I'm now alarmed that they don't have good sensation. Okay, so move this over a little bit here. Okay, Sabrina, so I'm going to have you close your eyes. Can you take off your glasses for me too? Excuse me, thank you. So I have 2 different sensations. I have a sharp sensation and I have a soft sensation. So if you want, I'm going to have you just bring your hand out so I can just show you what they should feel like because it's not too sharp. But you can tell this has more of kind of a pinprick. Okay. And then this one is more of a soft kind of brush. Yep. So soft or sharp. Okay. And what I'm going to do is I'm just testing your sensation around your face. So I want you to let me know if you feel a sharp sensation, a soft sensation, and then if you can also kind of sort of identify where at. Sure. Okay. So go ahead and close your eyes. And we're going to start here. It was soft on my cheek. Okay. Was that on your right or left? Left. Okay. Very good. And on my right forehead is pokey. Okay, very good. We're going to do one more here. Soft on my right cheek right here. Okay, very good. Thank you. Okay. Very good. So she would be a negative for all of those. And again, you just want to get different sensations throughout the face. So that is the sensory component, of testing our trigeminal nerve. So the next one, then we want to also test the motor component. Sometimes they might have sensation, but they might not have the motor component with that, or they might have a loss of function for both. So for the motor component, we're looking at jaw movement. So I'm going to ask Sabrina if she can protrude her jaw out and then do lateral deviation side to side. We're checking that motor component with that. Okay, so Sabrina, now we're going to check your motor component. All I want you to do is if you can open your mouth for me. Very good. And can you stick your jaw out? Good. And move that jaw side to side then. Okay, perfect. Everything looks good. All right, so another negative test there then for that. All right, now let's look at cranial nerve number 11. So we're looking at the accessory nerve. So if you guys remember back in 102 when you were looking at our anatomy, our muscle anatomy, remember that accessory nerve was with our traps. So now we're looking at the function of our traps. Specifically, we're looking at the upper trap. Remember that upper trap does elevation. So I'm going to be behind Sabrina. When I'm educating her on what this test is, I'm going to ask her just to shrug her shoulders. So she's going to shrug her shoulders. I'm going to be behind her. I'm going to put a force down, kind of almost like a manual muscle test in a way. So I'm putting a force down on her. I'm going to ask her to keep her shoulders shrugged. So a positive test would be the inability then to maintain that force and keep her keep her shoulders shrugged. So you're going to see that just come straight down. All right, Serena, I'm going to look at the function of your muscles here, kind of in your upper trap region here. Okay. What I want you to do is you're going to shrug your shoulders up. Excuse me, once they're shrugged up, I just want you to keep them shrugged. I'm going to come behind you and I'm just going to put a little bit of pressure on you. I just want to have you keep your shoulders shrugged. Okay. So go ahead, I'm going to have you shrug up. Very good. And then I just want you to hold as I press down. Hold, 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 hold. Okay, good. Go ahead and relax. Very good. So she was able to maintain that pressure the entire time. So again, she would be a negative test, thankfully. All right, and our last one that we're going to test is our hypoglossal nerve. So cranial nerve number 12. So this is a motor function. So we're only testing a motor function. We're looking at tongue movements now. When we think of glossal, we're thinking of tongue. So we're going to have the patient, they're going to just stick their tongue out and they're going to go from side to side. Now, sometimes too, what you can also look at is speech articulation. So you can imagine if they don't have proper motor function of their tongue, they're not going to have good speech articulation. So sometimes too, you might ask them to recite just 3 standard words. Can you say house, ball, and car for me? And we're assessing how they articulate their speech. But for lab, I just want to make sure that we're looking at the tongue movements. Okay, Sabrina, I want to just make sure that our tongue is functioning correctly. For me, while you're sitting there, can you stick your tongue out nice and wide, like so? Very good. And then can you bring your tongue cheek to cheek, side to side? Perfect. Very good. So she would have normal function of cranial nerve number 12. So again, there's 12 that we have. We have 12 cranial nerves, and we're going to look at some of that more in lab, some of the other ones that we're not testing. But these 5 cranial nerves, it's a perfect way to get a quick assessment. Even with a finger, can you check and see my eye movement? And it's a quick test that we should be saying if it's a positive, okay, this is a red flag, and immediately notify somebody. All right, that is all.